Okay guys, welcome back to part 4 of your pharmacology. We are going to start getting into the actual drugs that you guys have in your scope of practice. These next couple slides and the slides that are provided in your PowerPoint on your Brightspace shell, you're going to need to know all the information on every single one of these drugs, on every single one of these slides. So really, the way I've told my classes in the past is just cut these slides out, make some flashcards out of them. Okay? Really easy to do. All the information that you guys are going to need. You don't even have to read the chapter in your book on pharmacology, guys. All the information that you guys will need for this exam, for the National Registry Scope of Practice, for the New Mexico State Scope of Practice exam, for your pharmacology exam coming up in a couple weeks in lab. All of your pharmacology drug quizzes that you guys are going to take, all the information is right here in these PowerPoints, specifically on each slide for each drug. Okay? So, out of all the PowerPoints, out of all the different parts that I've done, this part 4 is probably going to be the most important to you guys because this is going to actually list off, and we're going to talk about every single drug in your scope, all in this part 4. First one we're going to talk about is acetaminophen. Okay, it's also known as Tylenol. All right, your class of drug, it has 2 different classes. It falls into 2 different classes. It's an analgesic, okay, which means it has some pain effectiveness to it, and it's an antipyretic, which means it is used for fevers. Okay, you guys, your indications at the EMT basic level at this time, okay, you guys are using it only for fevers in pediatric patients during long transport times to prevent febrile seizures. Okay, the definition of a long transport time is 30 minutes or greater. Okay, so on your pharmacology exam, and I ask for indications, okay, I don't want to hear fevers. I don't want to see fevers in pediatric patients. I want to see fevers in pediatric patients during long transport times to prevent febrile seizures. Okay, that is the correct answer for your indications. Everybody understand that, hopefully? Okay, I'll reiterate all this in class as well. Your indications for acetaminophen, also known as Tylenol, is fevers in pediatric patients during long transport times to prevent febrile seizures. And for you guys that are curious, the definition of a long transport time for the state of New Mexico is 30 minutes or greater. Okay? Contraindications, hypersensitivity to the drug. There are some people out there that can be allergic to acetaminophen. And hepatic failure or impairment. Hepatic means liver failure. Okay? Or hepatic means liver. All right? The hepatic system is the liver. Liver failure or any kind of impairment. Okay, so people that might say that they have a history of liver cancer or cirrhosis of the liver or any kind of hepatitis A, B, or C, we have to be careful with giving acetaminophen because it could damage the liver even more. Here's another thing I'm going to tell you guys about all these drugs. Okay, if I ask you for the allergy or the contraindication for acetaminophen, I am not going to accept hypersensitivity. Okay, because you guys can be hypersensitive to all these drugs, technically. Okay, now if that's the only answer on the slide, that's the only answer you guys are going to give. But specifically for acetaminophen, when I ask for the contraindications, I will not accept hypersensitivity. However, I will accept hepatic failure or impairment. Okay, because you guys can be hypersensitive to basically all of the drugs in your scope. Okay? Drug interactions, phenothiazines. Phenothiazine is a drug that we use for people with seizures. It's a class of drug known as phenothiazines. If we give this drug with somebody that takes a phenothiazine, it can actually produce a hypothermic state in the patient. Okay? And then phenobarbital is also another drug that we usually give for seizures. It's not really used too much anymore. But it can also, if we give Tylenol or acetaminophen on top of somebody that's already prescribed phenobarbital, it can increase the toxicity that's happening in the liver, and we can destroy the liver even more. Okay. Your administration, okay, your dose for pediatrics is 10 to 15 milligrams per kilogram. So this is the only weight-based drug you guys have in your scope. 10 to 15 milligrams per kilogram. We're going to give this orally. Okay, so they got to be able to swallow this. All right. And not to exceed 50 milligrams per kilogram per 24-hour period. Okay, so once again, if I ask for the dose of Tylenol or acetaminophen, I want 10 to 15 milligrams per kilogram orally, not to exceed 50 milligrams per kilogram per 24 hours. That is the correct answer. Okay, this one right now we are only using on kiddos. Okay, that is rapidly changing at the EMT basic level. You guys will more than likely be seeing this out in the streets where you guys can give this to adults here in town very shortly. Okay, next drug, acetylsalicylic acid. We abbreviate this ASA. This is also known as aspirin. Okay, some of the trade names for aspirin out there, you might see it as Bayer. Okay, Bayer aspirin. That's a big one. But the generic name for it is acetylsalicylic acid, or what we call, how we abbreviate it in the field as ASA. Okay. Acid falls into a bunch of different drug categories. It can be an anti-inflammatory, it can be an analgesic, it can be an antipyretic, it can be an anticoagulant, or it can be an antiplatelet aggregate. A lot of big words in there, right? You guys in the EMT basic scope of practice uses this medication as an antiplatelet aggregate only. Okay? So when I ask you guys for the class of drug of acetylsalicylic acid, or also known as aspirin, all you guys have to put down is it's an antiplatelet aggregate. Okay? So let's talk about this for a sec. We give this for people that we believe are having heart attacks, or what we call myocardial infarctions. Okay, that's the medical term for heart attack, or you might see it called as an acute myocardial infarction, or what we abbreviate it as an AMI. What aspirin does, okay, when we actually give it to our patient, right, when you have a heart attack, you have a clot somewhere in your coronary arteries, okay? You have a blood clot in your heart. That's basically what it is, okay? What the antiplatelet aggregate does is you guys have all these platelets floating around in your bloodstream. Those platelets help develop scabs. They help us heal. Okay, so when you guys cut your hand, you guys got a little scab or whatnot. Those are thousands to millions of platelets all kind of bundled up in order to help stop bleeding. Okay, the problem is when we have a clot, the body is so efficient at this that when we have a clot, these platelets are going to keep sticking to this clot, right? And it's going to make it bigger and bigger and bigger and bigger. Okay, so what aspirin does is it makes the platelets slippery. Okay, so it's not taking away the clot. Okay, what it's doing is it's not making the clot any bigger. Okay, because those platelets will hit that clot, and aspirin is actually going to make those platelets slippery that they just kind of bounce right off that clot. They don't have that ability to stick to the clot anymore. Okay, so that's what aspirin's all about, is an antiplatelet aggregate. Okay, that is the only reason why you guys are using it in the field. All right, yes, it's an anti-inflammatory. Okay, it can help with somebody that might have pulled a muscle or something like that. It's an analgesic. Some people use it for pain. It's an antipyretic. Some people can use it for fever reduction. It's an anticoagulant. Okay, it helps thin the blood. For people that have chronic issues, specifically with cardiac issues, they might be on a daily aspirin regimen to help keep their blood thin. Okay, you guys are using it as an antiplatelet aggregate. Okay, and all it's doing is not taking away the clot in the heart. It's making the platelets slippery so they bounce off the clot. They don't make the clot bigger. It doesn't take the clot away. It just doesn't make the clot any bigger. I'm going to say that again. It does not take the clot away. The clot will always be there until we can get them to the hospital and get them to remove the clot. What aspirin does is it makes the platelets slippery. Makes the platelets slippery so that the platelets do not attach to the clot and make the clot bigger. Okay? Indications, myocardial infarction patients, those are also known as patients having heart attacks, included suspected AMI patients, okay? Another way to put that for indications, make it nice and easy for you guys, all right, is cardiac chest pain. I'm sorry, let's put it like this. Is chest pain that you guys believe to be cardiac in nature, okay? Chest pain, which you guys believe is cardiac in nature. Something's wrong with the heart. We believe that this patient is suffering from a heart attack. Okay, we believe that this patient is having some kind of cardiac event, so we can give them aspirin, right? Now, you guys out in the field are going to be dispatched to somebody that says they have chest pain, and you show up and they've been shot 2 times in the chest. Okay, just because these people are having chest pain, right? And we found out that, oh, well, this guy has 2 bullets in his chest. Right? We're not going to give aspirin. This is chest pain that we believe as EMTs, as medical professionals, to be cardiac in nature. Okay? Contraindications, yep, hypersensitivity is there. I'm not going to accept it for an answer. Bleeding disorders. Okay? The last thing we want to do with somebody with a bleeding disorder is give them aspirin. Right? Yeah, we're using this for the antiplatelet, but it also falls into an anticoagulant category, into an anticoagulant class. So if we give them aspirin and they have a bleeding disorder, we're going to make their blood thinner and they could bleed out more. The big one is people with ulcers. Okay? People with ulcers. We want to ask our patients if they have a history of ulcers. Okay? If the patient does have a history of ulcers and it is actively bleeding, we cannot give the medication. I don't care if they're having chest pain that you believe to have cardiac, that's cardiac in nature. If they have active bleeding disorders going on, we cannot give this medication at the basic level. Okay? So, how do we find out if somebody has a bleeding disorder? Well, we got to ask them about their medical history. Right? We have to ask them, sir or ma'am, do you have any bleeding disorders? Do you know if you have any ulcers? Okay? People that have ulcers will know when they're bleeding. Okay? They're either going to be vomiting blood or they could be pooping blood. Okay? If they say that they've been vomiting blood or pooping blood, we cannot give aspirin. Now, if they have a history of ulcers and they are not complaining of any bleeding currently, active bleeding, they're not complaining of vomiting blood or they're not complaining of pooping blood, then it's okay to give the medication. Okay? That's a little tricky, guys. All right, so I'm going to say that again one more time, okay? If your patient has an active bleeding disorder, such as an ulcer, and your patient is actively throwing up blood or they're actively pooping blood, we cannot give aspirin. If they have a history of ulcers and they do not, or they haven't been complaining of vomiting blood and they haven't been complaining of pooping blood, then it's okay to give the medication because they are not actively bleeding. Okay? Administration, we only give this to adults. Okay, we do not give this to pediatrics. It only goes to adults. All right. The adult dose is anywhere, and I'm sorry, I want you guys to change that. It's anywhere between 81 milligrams and 324 milligrams orally for anybody that's complaining of chest pain that we believe to be cardiac in nature. Okay? Now, aspirin, you guys can see, we prefer these to be chewed. Okay? So when we give this to our patient, yes, we are giving this orally, but we want this patient to chew up the pills that we're going to give them and then swallow. Okay, so let's talk about this for a sec. Aspirin is a life-saving drug, specifically for somebody that's having a heart attack. Okay? It does wonders for people that are having heart attacks. Okay? So we have this medication that only comes in a pill, right? And if we give this pill orally and they swallow it, it's going to take anywhere between 30 and 60 minutes to hit the bloodstream. We don't have 30 or 60 minutes when it comes to a heart attack. Okay, this is a life-threatening event. So we have them chew it. We actually break the pill up, and it actually starts to dissolve in the mouth, and it actually enters the mucosa lining of the oral pharynx. Okay, so it starts entering the bloodstream almost right away. Okay, so yes, we do use chewable aspirin. We used to call it baby aspirin. Okay, we don't call it baby aspirin anymore. It's actually called low-dose aspirin now. We don't call it baby aspirin because people were giving it to babies and they were killing babies. Okay, something called Ray's syndrome or Rise syndrome, however you want to say it. You guys can look it up to see what the effects are, but it'll kill you. It'll kill a kid. Okay. So we do not give this to kids. It's only for adults. 81 milligrams to 324 milligrams. It is orally, but we want it chewed for anybody that is complaining of cardiac chest pain or chest pain that we believe to be cardiac in nature. Okay. There's special notes down there. All patients with a suspected heart attack or an acute myocardial infarction and without any contraindications will always receive aspirin, period. Okay? Okay, activated charcoal. It is very rare to see this nowadays. It is still in the New Mexico state scope of practice, and there still are some services out there that actually administer this. It's mostly our rural areas. Remember that we are a very rural state. We have a lot of land to cover. We're the 5th biggest state in the union. So we have some very outlining communities that really, it might take a while for a paramedic to get there. Okay. So some of these people still use, some of these services still use activated charcoal. And that's exactly what it is, guys. This is basically a bottle of Kingsford charcoal, all kind of mixed up, right? Blended up into a liquid. Sounds delicious. Well, let's talk about this real quick. The class of drug. Hey, only one class. That's great. It's a gastrointestinal adsorbent. It's not an absorbent. It's an adsorbent. What's the difference? This doesn't absorb the drug. Okay? It makes the drug so it doesn't bind to our system. It adds to the drug to make it a little bit too big in order for that drug to not get into our system. This is basically used for poisonings. Okay? Suspected poisonings. All right? It's used in the treatment of certain cases of poisonings and overdoses in an alert patient. Keywords there. In an alert patient. Okay? It is used in the pre-hospital setting before any kind of gastric lavage. That's basically where they go in and they suck out your stomach contents, or what you guys might know it as getting your stomach pumped. If a long transport time is anticipated. Again, that long transport time means 30 minutes or greater in the state of New Mexico. Contraindications to this. You can't give this if the poisoning was an acid, or if the poisoning was an alkali, or what's known as a base, unless there was other drugs ingested with it. Okay, we're going to talk about acids and alkalis later on this semester. All right, and the best people to call to see if they want to use activated charcoal, or to see if you can use activated charcoal, is poison control. Poison control is amazing. Now, that being said, they cannot tell you how to treat the patient. They can give you advice. They're not doctors. Okay, guys? When you call poison control, you are not talking to a doctor. You're usually talking to a pharmacist, to be honest with you. Or you guys are talking to a student who's finishing up their pharmacology degree. Okay? They're great. They're awesome. They are so knowledgeable. Okay, they could tell you what the patient might be experiencing, or what the patient might be experiencing down the road. Okay, but they cannot tell you to give medications. They cannot tell you how to treat the patient. All right, so if you guys are dealing with a poisoning, maybe you should call poison control to find out if this is an acid or an alkali that this patient ingested. Okay, but remember, it doesn't matter if the patient ingested multiple things. Okay, The other thing that we need to be careful with is if patient has a history of a GI obstruction. All right. Most of the people that get GI obstructions are little babies, which good luck having them drink this in the first place because it tastes like shit. Okay. Or older people. Okay. Our geriatric population. Okay. Guys, if you ever get a chance and you guys see activated charcoal somewhere, go ahead and take a swig. Okay. Imagine trying to explain to somebody to swallow this crap down. Okay. This is charcoal and water. And they got to drink this. They got to be able to swallow this. Okay? Good luck with that. All right? Just let them know it might save their life, and maybe they'll start chugging. But good luck with that. Okay? Drug interactions, you must, at the basic level, contact the MSEP before giving. Who is the MSEP? We've talked about this already this semester. The MSEP is the Medical Control Emergency Physician. Okay, this is the doctor that is, this is not your medical director. This is not the gentleman who's writing your protocols. This is the doctor at the receiving ER for the patient, right? So you're going to have to find out which hospital this patient wants to go to. And if before you give this medication, you need to call an ER doctor at that hospital and ask for permission to give this medication. And before you do that, you better have verified with poison control that this is neither an acid or an alkali, and let the doctor know that you have verified this drug with poison control, and get permission to give this medication and see if the doctor wants you to give it. If the doctor says no, you don't give the medication. Most of the time, the doctor's going to say, hey, follow your local protocols. Okay? And if you feel the need and you've talked to poison control that you need to give activated charcoal, then go ahead and give it. This one's easy for administration. Adult and pediatric doses are the exact same. Adult and pediatric dose is 1 gram per kilogram. So I lied earlier. This is your second weight-based drug. Acetaminophen was the first one. This is now your second weight-based drug. And yes, they have to swallow it. So this is an oral medication. Okay. The patient must be able to protect their own airway. And how is the one way that we know that the patient is able to control their own airway? We've talked about this already as well. The only way that we can guarantee that this patient is able to control their own airway, or any patient is able to control their own airway, is if the patient is able to swallow. Period. Okay? They might be able to talk, right? They might look perfectly normal for you, okay? But they might not be able to swallow. We have to make sure that this patient is able to swallow. That is the only way in EMS we can guarantee that this patient has an open and patent and able to protect their own airway.